Test item cluster for mechanical neck pain that benefit from thoracic manipulation. Number 1, symptoms lasting less than 30 days. Number 2, no symptoms distal to the shoulder. Number 3, fear avoidance belief questionnaire physical activity score less than 12 out of 24. Number 4, looking up doesn't aggravate symptoms. Number 5, diminished upper T-spine kyphosis. And number 6, cervical extension range of motion less than 30 degrees. Can you look up towards the ceiling? Test item cluster for full thickness rotator cuff tear and subacromial impingement. The 3 tests for full thickness rotator cuff tear are: number 1, drop arm sign. Bring your arm up and lower it down slowly. Painful arc sign, just bring your arm up to your ear and back down. And number 3 is the infraspinatus muscle test. I'm going to apply some pressure, don't let me push, hold, hold. And the 3 tests for subacromial impingement are painful arc sign, which was previously demonstrated, infraspinatus muscle test, which was also previously demonstrated, and Hawkins-Kennedy impingement sign. Test item cluster for mechanical neck pain that benefit from cervical manipulation. Number 1, symptoms lasting less than 38 days. Number 2, expectation that manipulation will help. Number 3, pain with posterior to anterior testing of the mid-cervical spine. Is that painful?
No.
Okay. And number 4, cervical rotation, range of motion difference of 10 degrees or more. Can you look to the left? And center? And can you look to the right? And center. Test item cluster for cervical radiculopathy. Number 1, upper limb tension test for median nerve bias. And to sensitize the test, I would ask the patient to side bend to the right. And number 2, distraction test. Number 3, Sperling test A. I'm going to apply some pressure. And Sperling test B. Side bend, extend, rotate, and I'm going to apply some pressure. And number 4, less than 60 degrees of ipsilateral cervical rotation. Can you look to the left? And center. Upper limb tension test B, radial nerve. And to sensitize the test, I would ask the patient to side bend to the right. I'm going to differentiate between a rotator cuff tear or shoulder impingement versus a C5 or C6 cervical radiculopathy. So with a cervical radiculopathy of the C5 or C6 level, I would expect a patient to have impaired sensation at the C5, C6 dermatome. So the C5 dermatome runs along the lateral arm here, and C6 goes into the thumb. I would also expect a diminished biceps reflex and brachioradialis reflex. So the biceps reflex here, I would expect no reflex, and brachioradialis, again, I would expect no reflex. A C5, C6 radiculopathy is also associated with weakness in shoulder abduction, elbow flexion, and wrist extension. So I would go through and test all 3 of those. So for shoulder abduction, bring your arm out to the side here. Don't let me push. Elbow flexion. Don't let me pull. And wrist extension. Don't let me push. So all 3 of those would be weak. Also, a patient would be positive for the test item cluster for cervical radiculopathy, and these include the upper limb tension test, median nerve bias, Sperling test, distraction test, and less than 60 degrees of ipsilateral cervical rotation, which all of these were demonstrated earlier. So if a patient had diminished reflexes, impaired sensation at the C5, C6 dermatome, and weakness at the C5, C6 myotome and was positive for the test item cluster for cervical radiculopathy, I would rule in a C5, C6 cervical radiculopathy. If a patient had intact sensation, had intact reflexes, and were strong in their elbow flexion and wrist extension, I would lean more towards either a rotator cuff tear or a shoulder impingement. If I thought it was a rotator cuff tear, I would do the test item cluster for that, which includes the drop arm sign, infraspinatus muscle test, and painful arc sign. If I thought it was more of a shoulder impingement, I would do the Hawkins-Kennedy impingement test, infraspinatus muscle test, and the painful arc sign. And if for either one of those clusters, if they were positive, then I would either rule in the rotator cuff tear or the shoulder impingement. Active compression test of O'Brien. Your arm up, thumb down. I'm going to apply resistance. Don't let me push. Hold, hold, and then turn your thumb up. Same thing. Don't let me push. Hold, hold. Alar ligament stress test. Empty can test. I'm going to bring your arm up, thumb down. I'm going to apply some resistance. Don't let me push. Hold, hold. Lift off sign or Gerber's test. Can you lift your hand away from your back? Now I'm going to put some pressure on the palm of your hand, but don't let me push. Hold, hold.